Turning now to the devastating toll the coronavirus is having on the globe. Worldwide, cases are now nearing the 57 million mark, and more than 1 million people have died. In Mexico, COVID-19 deaths crossed 100,000 on Thursday, making the country the fourth nation in the world to do so. The milestone comes less than a week after the country surpassed 1 million positive cases. Officials say that number could be much higher because of low levels of testing being done. Meanwhile, India has reached over 9 million confirmed cases and 132,000 deaths since the pandemic began. Today, the health ministry reported over 45,000 new infections in the last 24 hours. But it's not all bad news for the country. New daily cases have seen a decline over the last few weeks. In Brazil, the first 120,000 doses of a vaccine developed in China have officially arrived in Sao Paulo's International Airport. The doses will reportedly be stored in an undisclosed warehouse as the state awaits approval for its use. Officials say the final phase 3 trials to assess the efficacy and safety of the vaccine are still ongoing. And as we head into the weekend, the U.S. is reporting record coronavirus numbers. So far, more than 11.7 million Americans have fallen ill and over 252,000 have died. The White House Coronavirus Task Force announced that an application for emergency use of the Pfizer vaccine is expected to be filed with the FDA today. And it comes as COVID-19 hospitalizations in the country are on a rise in all 50 states. According to the American Hospital Association, nearly 20% of Americans rely on rural hospitals, and they are quickly becoming overwhelmed. Carter Evans got an inside look at how a small hospital in Rupert, Idaho is dealing with the crisis.
With more people testing positive for the coronavirus every day, rural hospitals are struggling to keep up. We got a look inside Minidoka Memorial in southern Idaho, where they have 17 beds and room for only 3 COVID patients.
This is what we call the anteroom.
Nurse Melissa Bedke has already been helping transfer the most critically ill to other larger hospitals for months.
How soon do you think you'll have a COVID patient back in here?
We've only had a room open for like 12 hours at a time.
As many of those hospitals near capacity, she worries about what's coming.
Have you ever had to make a decision who gets care and who doesn't?
We've trained to things like that, and training's so different than when you actually get the real live body in here to figure out what to do, and we haven't.
This is one of the hospital's makeshift COVID rooms. You can see they've separated it out here with plastic, a window so nurses can see through. They've also reversed the air conditioning system so the air is sucked in and no virus can come out.
This 85-year-old man is infected and has been hospitalized here for 4 days.
Is he getting better?
He's pretty weak, and that's one of the common symptoms for a lot of people.
Kelsey Phillips and nurses at small hospitals around the country are working nonstop.
It's very tiring and exhausting. You're breathing the same air all day long.
And for them, concern about the virus doesn't end when their shift is over.
You got kids.
Mm-hmm.
You worry about bringing this home to them?
Sure I do. Yes, I have a son who has asthma. My husband and I both work here, so when we get home, we are stripping in the garage, throw our clothes into the washer on the way through. The kids have to stay in their room. It's changed the way we have to do things at home, not just at work.
So Carter Evans is joining us now from Rupert, Idaho, with more on how rural hospitals are handling the pandemic. You know, the first thing I thought of when I saw your piece there, Carter, is whether or not they have everything they need moving forward. These are small hospitals. Is there enough PPE? Are there enough resources? Are there enough humans? We've talked already about staff shortages in areas that have much larger hospitals.
And the answer to that is, thankfully, yes, they have enough PPE right now. What they are lacking are testing supplies. They still say they don't have enough accurate tests. They have some rapid test ability, and then they have another test that takes about an hour that's much more accurate. But the supplies for the test that takes an hour, the accurate one, well, they're in short supply.
Yeah, when you say there's only enough space for 3 COVID patients, I think that could very quickly be not enough space at all. What are the plans for some of the bigger hospitals in the region if they reach capacity?
Right, so that's a big concern. What happens when they reach capacity? They would go to a crisis mode, and that would be declared by the governor. And then at that point, doctors would have to decide who gets a bed and who doesn't. I spoke with the medical director of the largest hospital here in Idaho, and I asked him, I said, you know, what happens if a heart attack victim comes in and you've got a bunch of COVID patients? He said, well, we'll look at the COVID patients and the heart attack victim, and the one who has a more likely chance of survival will get the bed.
I'm wondering what preparations are for the weeks following Thanksgiving. The CDC is asking people not to travel, but AAA says they expect travel to be down 10%. In a normal year, that might be significant, but 10% during a pandemic, I think, is nowhere near enough considering what the recommendation is. So, you know, there's a good likelihood we're going to see spikes following the Thanksgiving weekend. How are these rural hospitals getting ready for that?
They are absolutely expecting a spike 2 weeks after Thanksgiving. They say they're still dealing with the spike right now after people gathered for Halloween. Also, you got to remember here, not everybody wants to adhere to these mask guidelines. They're not a mandate here, they're guidelines. You go into the stores around town and you'll see about 75% of the people wearing masks, and you'll see other people walking around proudly without masks. So that's a big concern. It's expected that people will gather for Thanksgiving, and then as the virus incubates and begins to expose in people, well, they'll be coming here to the hospital.
Yes, they will. There's nowhere else to go. Carter Evans, thank you so much.
Sure.